We wait for you to get sick, and you do. Then, once you are sick, we don't restore your health.
This is the secret hospitals and insurance companies don't want you to know. Coming from an insurance agent.
Do y'all remember when the Democrats said that the Affordable Care Act was going to make healthcare affordable? Yeah, well, about that. Let's break this down Barney style because economics is hard.
Me and Gen Z loses our parents' health insurance at 26, so here's the U.S. healthcare scam explained in 2 minutes.
You denied a $539 inhaler. A 22-year-old had to choose rent, and as a result, he's dead.
Good rising, family. Welcome back to another episode of Lady Boss Energy, where we uplift, motivate, and inspire each other to get shit together. If you haven't already, please like, comment, and subscribe. And if you know somebody who you think would enjoy watching this, share with them. So I chose to do a black and white filter today because why not? It's fun. On today's episode of getting our shit together and realizing that these people are full of shit, I chose insurance and the things they don't want us to know. Because you know what? There's a lot of things that I didn't know. And I'm like, wait, what? You can do that? Or wait, what? That's how it really goes? And I'm going to tell you this. During my rabbit hole of the world of insurance, I concluded that it is cheaper to just not have insurance. Unless you have like a lot of health problems, then. But if you're a healthy person and you have no, like, you don't go to the hospital very often, or you might need to get like a little MRI or something done, it's cheaper just to pay out of pocket. But we are going to get into that. Affirmation time is affirmation time is affirmation time is affirmation time. I am one with the power that created me. Yes, I am. Are you one with the power that created you? I'm not talking about religion either. I give myself the care and attention I deserve. Prepare a healthy meal for yourself. I need to do that because I haven't been eating healthy lately. I have been eating things that I know better not to eat. But old habits die hard. And I thought I was over that part of myself. I saw a video that said I found my rhythm when I realized the steps backwards were a part of the dance. So if you're slacking, if you're lacking, it's okay. It's part of the dance. Find your rhythm. And it's going to be okay. Listen, I'm here to tell you, everything's going to be all right. And even if it's not, worrying about it isn't going to make it go away or make it better. It's just going to stress you out. It's about living in the moment, living in the now. When people say time is an illusion, it's an illusion because the time is always now. It's always right now. And I know we have clocks and things to say, oh, it's 7 o'clock, but now it's 7:05, and that is where the illusion comes in at, because time is an illusion. A quote for the day, because a quote today, my dear, keeps the mediocre away. If you want to go fast, go alone. If you want to go far, go together. Ooh, I like that. Ain't nothing to it but to do it. Let's get straight into it.
13, 14, 15, 16, $17 go to administrative costs. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. All this money is used to pay big insurance to push paper. It's death by 200 billion paper cuts. Private companies spend 17 times more on administrative costs than Medicare. What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare for All. And those savings, they could go to expand Medicare. There's a cost to letting insurers paperwork patients and providers to death, and that cost of inaction is $200 billion on administrative costs. Now, administrative costs waste money, but they also waste healthcare workers' time. A recent study found that a majority of doctors, 56%, support a single-payer healthcare program. Why? Because today doctors spend only 1/4 of their time with patients. What are they doing with the rest of their time? Paperwork. Medicare for All would save money on administrative costs, $200 billion a year. Medicare for All would give patients the most choices, 99% of non-pediatric providers, and Medicare would let doctors practice medicine. Not surprisingly, given these three things, what do we get with Medicare for All? Better health outcomes. And that's why I support Medicare for All, because I support patients over paperwork.
They don't want that. They don't want that.
If a patient comes in and they tell me they fell, and I write that in the chart, patient fell, they fell at work, their health insurance might deny that claim and say, what do you mean they fell at work? You said in your note. That means workers' compensation has to cover it, not us. The same thing will happen with a car accident. A patient will come to see me and they'll say my back hurts, but in the note they'll say, oh, I had a car accident 4 years ago. The insurance will deny it and say the auto insurance is supposed to pay for this. So they all kick the bucket on who's supposed to make the payment. Like, you cannot imagine a more broken system. And the fact that it still somehow works is magical.
It is not magical at all.
Sir, you've had an accident. We're going to put you in the ambulance and get you over to the...
Whoa, hold up. I'm not taking an ambulance.
No, you really need to go to the hospital.
My insurance won't cover an ambulance. I'll just walk.
You fell off a 30-foot ladder. Your legs are broken. Yeah, your knee is pointing backwards like a dog or a small horse. But don't worry, this is an emergency. Your insurance is going to cover it.
Yeah, unless the ambulance company is out of network.
Actually, Congress passed the No Surprises Act in 2021, which prohibits surprise billing for an out-of-network emergency service.
But that bill doesn't include ambulances.
Yeah, I'm pretty sure it includes ambulances. Oh, no, he's right. It doesn't include ground ambulances. It does include air ambulances. Why would that bill include a helicopter and not a ground ambulance? There are so many emergency transport services operated by municipal and county governments that all the different state regulations gave Congress a headache, so they just left out ground ambulances.
I'll take a helicopter.
The hospital's only 2 blocks away.
Well, can I call my insurance company and check with them?
I'm sorry, we just don't have time. So Congress left out ground ambulances from the No Surprises Act, which, by the way, is one of the most common surprise bills that people get, simply because it was hard to figure out? Oh, please don't nod. You technically don't have a C-spine anymore. Well, yeah, but they said they're going to revisit it later, and, Congress typically does what they say they're going to do.
Wait, so how much am I in the hole for having you guys come save my life?
$1,200, give or take. But only 50% of ambulance rides result in an exorbitant out-of-network bill, so chances are you'll be fine.
All right, let's go. I hope taking the time to have this discussion doesn't impact your job performance metrics.
Nah, this is America. We factor in a lengthy discussion about insurance coverage into our call response times.
That's crazy.
He states that it's not medically necessary treatment.
That was an internal phone call between 2 United Healthcare workers. They're laughing about denying someone's insurance claim. We're ProPublica, a nonprofit newsroom, and we investigated. The person they're laughing about is Chris McNaughton. He was in college when he was diagnosed with ulcerative colitis, a chronic autoimmune disease. It took him a really long time to find meds that put his disease into remission. But when he finally did, United flagged Chris's case as a high-dollar account. Ultimately, United said it wouldn't pay for his medicine because it was not medically necessary.
When I started that treatment, I think I had literally failed every other ulcerative colitis medication. So it would almost seem that it was the very definition of medically necessary, and then nothing else had worked.
When United turned down Chris's claim, his medical bills were running nearly $2 million a year, so Chris did something few people ever do. He sued. He was able to get his claim filed and question United representatives under oath. He was shocked by what he learned, like that a United doctor had literally cut and pasted denial language from a nurse's notes.
That's under RN recommendation. I usually copy that and paste it if I agree.
That doctor said he's done over 10,000 denials for United, and he didn't usually look at the medical records, he just signed his name. Chris's records revealed another United doctor who actually agreed with Chris's physician was ignored. United had paid for that doctor's opinion, but when the company didn't like what it saw, it buried that report. Chris also got emails and audio recordings, like the one at the beginning of this video.
It's hard to feel that they're really worried about your safety when there are emails that are celebrating the fact that your treatment was denied.
In the end, Chris's medications were paid for by insurance. United said in a statement that the company's guiding concern was always his well-being. We aren't done reporting. If you have information about insurance denials you can share, get in touch with us. And if you're interested in appealing your own denial, learn how to request your insurance claim file at propublica.org/claimmyfile.
Yeah, it didn't sound like they were concerned about his well-being.
You denied a $539 inhaler. A 22-year-old had to choose rent. And as a result, he's dead. This is Aaron from Social Work. I'm calling about case number 774-589. Yeah, this is a 22-year-old. He was denied the inhaler. Yep. Well, I'm calling to let you know that he's not going to need that anymore. He made the choice that he was going to pay his rent, like most people, and unfortunately, he didn't make it. He died. He had an asthmatic attack because he didn't have the inhaler. He didn't have the inhaler because you denied it, because you were proposing step therapy. You wanted him to fail a couple other more conservative treatments, and that gamble on him failed for him. Yeah, he could have paid out of pocket $539. That was his rent. How would you expect that he was going to make that? Don't say step therapy. You told a 22-year-old to keep struggling until their lungs proved that they deserved help. That's what you said. Look, I'm not calling to argue or fight this with you. I am calling so that someone has to read this transcript back and that it's part of the record.
That's sad, bro.
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that started 2024, AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir. You should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
Hey there, submitting a claim for some medical procedures. Sure, denied. Wait, you didn't even look at it. Them's the breaks. Next. You can't just do that. Sure I can. What are you gonna do about it? Appeal? The insurance industry made that process as complicated as possible. You'll never figure it out. The health insurance industry is confusing at best and predatory at worst. And Holden Carl found that out the hard way through struggles with her own insurance company, but the talented software engineer was not gonna take that lying down. She said, I'm gonna make you pay. Literally. Imagine being so pissed off, you use your unique skill set to develop an AI tool called Fight Health Insurance that can write an appeal for a denied insurance claim in 10 minutes or less. And then imagine making the tool free for the public so everyone can fight their health insurance company. I mean, her tagline is very literally, make your health insurance company cry too. We love a petty queen. The URL is fighthealthinsurance.com, and if your health insurance company is denying your claim for medically necessary care, this is the first place I go. I'm Vivian, your BFF, and your favorite Wall Street girlie who's teaching you all the financial hacks you never got in school. Follow me.
I do.
Do y'all remember when the Democrats said that the Affordable Care Act was going to make healthcare affordable? Yeah, well, about that. Let's break this down Barney style because economics is hard. The ACA did not make anything cheaper. What it did is it made insurance mandatory and told companies that they had to cover more stuff for more people, whether they needed it or not. And when you add coverage, prices go up, not down. That is simple math. But then they realized, people can't afford these new prices. So what do? They created subsidies. What are subsidies? Taxpayer money to help pay the bill. So say your plan is $800 a month. The government helps with $400. Well, guess what? It's still an $800 plan. You just didn't see the other half of that come out of your pocket. This is not girl math. It does not make it cheaper. It just hides the real price tag and shifts the bill to the taxpayers. And that missing $400 goes straight to the insurance companies. It's like welfare for billion-dollar corporations. And now the Democrats in the Senate are holding up the government over another $1.5 trillion to extend those same subsidies that were always meant to expire this year, by the way. They're not out there fighting for your doctor visits to get cheaper. They're out there fighting for their donors' profit margins. So no, subsidizing the ACA did not make healthcare affordable. It just made insurance companies richer while the taxpayers got the bill. So if you're mad that you're not going to be getting your SNAP benefits because the government is still shut down, maybe pick up the phone and call your Democratic senator. This was fun. Have a day.
If you ever have to go to the emergency room and you don't got the greatest health insurance, never give them your information, alright? You don't have to, legally. They're gonna try and ask you what your name is, what your social security number is, where you live, all while you're having an emergency, mind you. But it's a trap, alright? The only reason they're asking those questions is so they can take your information and take you to collections and make sure you pay up, okay? It's a shakedown. Don't fall for it. They gotta treat you legally, regardless of your ability to pay, no matter what. So make sure your family knows the game plan, alright? You are John Doe, you are Jane Doe. They don't know you from Adam, okay? They're gonna try and get the information out of you, but keep your mouth shut, alright? They might give you the runaround, you might have to wait a little bit longer, alright? But if it's a true life-threatening emergency situation, you're good, alright? They will take care of you. And once you come to, they're gonna make it seem like you can't leave until you give them all your information. But let me tell you a secret, alright? Unless you got handcuffs tied to the bed, you can get up, alright? And just walk out the door, alright? You can just walk out the door. See you later, alright? You don't have to give them nothing. Otherwise, you're gonna be on the hook for a $10,000 hospital bill for those 12 hours of agonizing pain you spent, only to be given 2 tablets of Tylenol Extra Strength. So unless you want to be a debt slave to these wonderful for-profit healthcare providers, I suggest you take my advice. Keep your mouth shut, alright? Happy counting.
And he said it's legal. It's not illegal to do it.
This is the secret hospitals and insurance companies don't want you to know. Coming from an insurance agent. So listen to this. My client Steve hurt his shoulder. He went to the doctor. Doctor's like, I don't know what's going on. Let's order an MRI. Now, if you don't know how expensive MRIs are, you can just take me for example. In 2017, I had back surgery. The year before that, my doctor who worked in the hospital, my surgeon, he sent me downstairs to get an MRI. And so I gave him my Blue Cross Blue Shield card, and that was that. Until I got a bill in the mail for $3,500. $3,500 for one MRI. Now, this is a good hack. Whenever your doctor is prescribing any sort of treatment, whether that's imaging, lab work, honestly, anything you can have done at the doctor's office, hospital, there's a code for it. So Steve's wife got the codes. I told her to Google MRI near me, call around and see if she could get some pricing. She just called me back and she was able to find a place that charges $425 for the MRI. However, they'll charge that until 8 p.m. They stay open until 11 p.m. And between 8 p.m. and 11 p.m., the MRI would be $350. Very interesting, but those prices are if they go in self-pay. Pay cash, upfront, no health insurance. My MRI was so expensive because, first of all, I got it done in a $100 million hospital building. But on top of that, I used my Blue Cross Blue Shield insurance. And when a hospital doctor's office sees an insurance card, now they got insurance money. So they can charge whatever they want to, but you're still responsible for your deductible. Sadly, paying cash is like 10 times cheaper than using your insurance card. Here's the real secret. Steve can submit a claim to his health insurance supplement and they will send him a check in the mail to reimburse him. Here's the crazy part. Steve's supplement pays per day for an MRI $700. That means they're gonna send him a check in the mail for $700. That's because these plans are like a contract. They pay exactly what they say they do, no matter what the bill is. So if the bill is $350, they're paying $700. If it's $3,000, they're still paying $700. Click the link in my bio if you want to get paid to go to the doctor.
That was some good information.
Here's some legal hacks that insurance companies don't want you to know about your accident case. Number one, you don't have to accept the first offer that's thrown your way. Insurance adjusters will try to lowball you by offering you a settlement that's far less than what your case is actually worth. Now they do this because they know you don't know the true value of your claim. Don't fall for this. Number two, you don't have to talk to the insurance claims adjuster. Insurance claims adjusters will ask you leading questions trying to trip you up so they can deny your claim. Number three, the insurance company of the other driver is not your friend. Don't be fooled by the soft, sweet, friendly voice of the insurance adjuster. Their goal is to get information from you so they can protect themselves and limit the amount of money they may have to pay you. Number four, hire a personal injury attorney. Hiring a personal injury attorney will put you in the best position to ensure that your rights are protected and the insurance company doesn't try to take advantage of you. Insurance companies try to do this when they know that you're not represented. So make sure that if you're in an accident, you get one.
That was some good information too.
Secrets insurance companies do not want you to know, part 1. If you were injured in an accident and file a claim, then the insurance company is probably going to call you shortly after the accident to give a recorded statement. And if they do, then keep in mind in most situations you have no legal obligation to give them any sort of recorded statement. The main reason the insurance company does this is to gather facts that they can then use against you to deny or limit your claims. So if you ever are in this unfortunate situation, then make sure that you don't fall victim to the insurance company's tactics.
These are all good.
Insurance secrets they don't want you to know. They monitor your fitness tracker data.
If you're claiming injury, but your Apple Watch is showing 15,000 steps a day or the day of your accident, you're done.
Take it off immediately after any accident and keep it off until your case closes.
Secret number 2, they have teams of people stalking your social media profiles 24/7.
That innocent beach photo, that's exhibit A as to why you're not really hurt.
Complete social media blackout, or it will destroy your entire case. Secret number 3, those preferred repair shops have deals in place to use cheap and inexpensive parts.
Always demand OEM parts in writing or your car won't be safe. And the biggest secret, they're counting on you not knowing anything.
Now you do, and you're welcome.
Life insurance is the world's safest industry.
There's an account that yields 5 to 6 times more than long-term CDs, has guaranteed returns in most cases, does not have to be reported to the IRS, can be accessed by any time without penalty, lets you retire 100% income tax-free, and yet almost no one knows how wonderful these plans are because the government places tight restrictions on the advertising of these accounts, even though they are 100% legal. Why are they secret? I'll tell you in a moment. Because they can't make a dime off of them. If we sold cash value life insurance to everybody in America, there would be no tax revenue for these guys to screw up.
Life insurance.
Why is insurance a scam? I mean, I could go on a rant on this. I used to sell health insurance at 18 and 19 years old. And when I used to sell different types of plans, certain plans only covered you 60 or 50%. So think about this. You're paying some deductible, and then you go into the professionals and they tell you, well, you can only cover 50%. And then on top of that, when you go into the system, now they say everything is out of network. So they get somebody from the 5th floor to come down to the 4th floor. That is out of network. So you're going to have to pay double. You might have to pay triple. So if you think about it, instead of spending all this money on insurance, which they're not going to cover you and they really don't care to, I mean, United has AI installed to not cover people. So instead of spending your money on insurance, you should just eat organic. Take care of your health because that is more important than going into the system, which is just trying to milk you the entire time. And if you look into it and you look into how many things are covered and all this and these rising premiums, and here's the other thing. This was the other crazy part about the insurance situation, was the fact that healthy people used to get a discount back in about 2010. If you were healthy, like for example, you worked out and took care of yourself, you would get a discount. But after 2012 and you're healthy, you don't get a discount anymore because you're paying for everybody. So if this person over here decides not to be healthy, you're paying for them. Your insurance premiums are going up because these people are deciding not to be healthy. Think about a system like that. Actually, we live in that system. It's part of the socialist system that we have as well, too. So the insurance situation was people when they're wondering why their premiums go up, because if these people over here aren't healthy, you're going to pay for them too. So you're taking care of your health, then investing into a system which is just trying to milk you and not cover you.
So I don't normally jump on that health insurance is a scam, but today it is absolutely a scam and I swear it's fraud. I need an MRI on my back because I hurt my back. My clinic sent it over to a hospital. They ran it through my insurance. They called me and said, hey, your portion of it that you're going to have to pay after insurance is $5,100 for this MRI. So I'm like, wow, okay. I was like, before we do that, just wait, because I'm like, $5,100 just seems wild. I called another place who was also waiting for my insurance to go through to see how much it was going to be. My insurance was still on hold with them, but I asked them, hey, if I just cash pay this, how much is it going to cost for this MRI? And they're like, well, if you just want to cash pay it, not run anything through insurance, it's $700. And so I'm like, sounds a lot better than $5,100.
Yeah,
so I called the original hospital back and said, hey, if I don't run this through insurance, what is the cost if I just decide to self-pay it, since I know the other place is $700? The lady's like, I'll rerun it under you being self-pay and I'll call you back with your total. So a few minutes go by, the lady calls me back and she goes, hey, I talked to my supervisor. Since you have insurance, we are not going to let you self-pay it, so we won't give you that number.
That should be your choice.
How is that not a scam? Isn't it my choice if I want to self-pay something versus running it through my insurance?
Yeah.
How I should get to decide that, not you, but they're like, nope, since you have insurance and you've already done it that way, we are not going to allow you to self-pay it. And I think that's because they probably were going to give me a self-pay price, kind of like the other place, maybe a $700, maybe up to $1,300, still way less than $5,100 that it was going to make me pay. And I just think, what if, somebody wouldn't, what if I wouldn't have called around? I would have been stuck with this $5,100 bill. Insurance is such a ripoff. I don't know how in the world this hospital is telling me that I now can't self-pay it. What does it matter? I'm going to go to the other place, but I don't know how this hospital is allowed to now tell me, hey, yeah, you can't self-pay something if you have already had us run it through your insurance. I haven't even had it yet.
So The key is to not tell them that you have insurance.
There's a real
if you're
chance that
getting
this
little
man right here
things
may
like
have
that
just
done.
saved your life. If you don't live in the United States, you've probably never heard of him, but your grandkids are going to read about him in school. With a single tweet, he shook the whole world. One of the reasons why is because he used a word. The word is called a nutraceutical. Do you know what a nutraceutical is? Most adults in America have never heard of a nutraceutical. Most adults in America are taking something called a pharmaceutical. They're taking a pill for their blood pressure or their cholesterol or their diabetes or their weight control or appetite or their mental health or something else. The drug companies have invested billions of dollars in drugs that go in the physician's desk reference. And every day around lunchtime, these drug companies bring your doctor and his staff lunch. The reason why is they want your doctor to know about their drugs that are in the physician's desk reference, their pharmaceutical drugs, to sell you more medication. But here's the thing. A nutraceutical is something that has the same effect as the pharmaceutical, only it's natural and there are no side effects.
What?
Ever since this tweet got published, the pharmaceutical stock's been crashing. Did you know that buried in hundreds of pages in the physician's desk reference, there are nutraceuticals that do the same thing as your pharmaceuticals, but with no side effects? This would mean people are getting off of drugs, they're saving money, and they're getting healthier. This will save lives all over the world, and it could also make the pharmaceutical companies very, very unhappy. I'm grateful for brave people that stand up and speak truth, even if it's not popular.
Nutraceuticals, family.
Because they're lying to you. Whether they know it or not, they're lying to you. And it drives me crazy because I've seen the internal documents where each carrier has some version of probably what you show your customers, which is a pie chart of what's called asset allocation. And insurance is like a tiny little sliver of the pie. The problem is, in insurance agent world, pretending to be financial advisors, they tell you it's the whole pie. And the only person eating that pie is everyone in the commission chain, and you are the sucker.
Oh my God! Specimen Z isn't Carter's body. What is it? Specimen Z is a cure for cancer. Carter didn't die, he cured himself.
Hold it right there.
Carter, you found a cure for cancer?
I didn't come up with it. A couple of eggheads I hired did. One of them's a Chinese. Boy, I don't like those people. But holy crap, wind them up and watch them go.
How long have you had this?
I don't know. When was that Who Let the Dogs Out song?
You've had this since 1999?
I could have you arrested for breaking in here.
Carter, you've discovered the holy grail of modern medicine. Why the hell would you keep it buried like this?
Well, I'll tell you why. Because there's far more money to be made in treating a disease than in curing it. Why cure someone of cancer in a day if we can treat them for a lifetime and bill them every step along the way?
What? That's insane! Carter, what you're doing here is criminal, and I'm gonna tell the whole world about it.
Is that right? Who's gonna believe you? The internet? You'll be just another nutjob left-wing blogger.
We're now learning that of the 62 people killed in the plane crash in Brazil, 8 of them were cancer specialists that were on their way to an oncology conference. And just imagine this, but the Regional Medical Council said there was actually 15 cancer doctors.
Wow. I'm so tired of this country and these people, bro. I'm so tired of it.
We wait for you to get sick, and you do. Then once you are sick, we don't restore your health. The doctor gives us a toxic pill which makes us sicker and keeps us sick. We merely manage your symptoms. So we can manage your high blood pressure, we can manage your cholesterol, we can manage your pain, your arthritis pain, we can manage your diabetes. We don't cure you. The current healthcare system is a hoax. It is not a healthcare system, it is a disease management system. We need to have a revolution in healthcare.
Yes, we do.
I'm gonna tell you something that insurance companies don't want you to know. Knowing this got me a check for $3,000 one time. If you ever get into a wreck, that's not your fault. Make sure you ask the other person's insurance company for a check for depreciation of your vehicle. I got into a wreck that wasn't my fault in my brand new 4Runner, and they sent me a check for over $3,000 because it depreciated my value of my vehicle so much. Had I not known that, I would have never gotten the check because the insurance company is obviously not going to tell you that. They're going to give you more money if you ask for that. So if you ever get in a wreck, that's not your fault. Make sure you ask the insurance company for that compensation because the value of your car just decreased a ton and they should compensate you for that.
Yeah. That's some good information right there.
Shit Insurance Doesn't Want You to Know, Car Edition, and technically still House Edition. So now TikTok, first and foremost, I want to tell you that I am in absolutely no way at all telling people what they need to do. I am merely telling them what they can do, what I have done, and what I'd recommend them to do. So now let's say that you were in a small little car wrecky, a little boomer, right? Somebody has run into you at a little red light, they have hit your car in a parking lot, you know, something like that. I'm not talking about anything major, guys, all right? That's a whole other ballgame. But when it is something small, or say the fact that somebody maybe misses a curve and runs into your house. Maybe old Granny over there just hits the gas instead of the brake and just plows right into that dang thing. Now, our first inclination is to use our insurance and file a claim. And in that case, you know, we're paying deductibles and coming out of pockets for something that just wasn't our fault. And I don't know about you, but I don't think that that's fair. So instead, what I would do, what I have done, what I recommend, is that you actually file a claim with their insurance, and therefore they are taking the cost and you aren't paying a deductible. Now, I know there's going to be some agents or some people that are going to be like, no, don't do that. Of course they don't want you to do that, but I'm telling you, that's what I've done. My bank account is a lot happier when I let somebody else pay to fix my vehicle when they're the ones that damaged it. Shit Your Insurance Doesn't Want You to Know, Part 2. Again, let's see how long it takes TikTok to take sound off of my videos, because I am out here doing the Lord's work, making sure that you as a homeowner know what you need to know about insurance and your property to not get raked over the coals by insurance. Guys, another one of the big important things is that say that you have something happen, whether it be a fire, whether it is a hurricane, a tornado, hail, a toilet blows up, the fridge blows up, whatever the situation is, one of the most important things that you need to know when filing your claim: date of loss. Day in and day out, insurance denies claims for one sticky little thing, and that is you verifying the actual date of loss. That's it. That's as simple as it is. So say that you are somebody that has a hail claim. One of the first things that insurance is going to do is they are going to go on their little databases, and they have it, and contractors have it, and weather companies have it. There's a lot of ways of finding this shit out. They are going to go on there and go, so-and-so said that they have a claim for hail on this date. First thing they're going to do is they're going to go on that little thing, and they're going to look to see if there was hail in your area on that date. Guys, it is absolutely imperative that whenever you file a claim, the date of loss is correct. Don't shoot yourself right out of the gate. Make sure that you know the date that your damage actually occurred. You're welcome.
Did you know corporations can take life insurance out on you? It started with slavery. Insurance companies like Aetna wrote policies on enslaved people. If the slave died, the owner got paid. They hedged their investment. Today, companies take out dead peasant policies on employees. If you drop dead at your desk, they collect a check. To them, you are not a person. You are a depreciating asset with a payout clause. Check if your company has one on you. Link in bio.
That's crazy.
There are quite a few things that the insurance company knows that they don't want you to know. First, the insurance company knows every accident that you have ever been in. It doesn't matter if they were involved in that accident in any way, shape, or form, they know about it. They have a list that they share. Number two, insurance companies love to be on social media. And I'm not talking posting. What they like to do is look at your social media. So if you have any public social media that's available, expect that the insurance company knows about it and has looked through it. Number three, insurance companies will hire private investigators to surveil you. They will not tell you about it. You don't have to file a lawsuit. You simply have to have made a claim, and if they determine that claim is valuable enough, they will hire a private investigator to sit outside of your house or your place of work and look at you and follow you and watch your day-to-day activities.
Insurance companies will lie just to not pay you your fair share. My client was riding a buggy, and he had two passengers behind him. And you know how buggies are always on the side of the road, you can't be in the middle of the road? A freaking bus rear ends this buggy, slams into him, and so he slams into another vehicle. The insurance adjuster calls me and goes, I have a witness that says that your client was weaving in and out of the road, and that's what caused the accident. And we have a video. I ask for the witness statement and I ask for the video. She gives me the witness statement, not notarized, not acknowledged by any notary public, just somebody giving a statement, very likely drafted by the insurance company. Then I get a video I get the back of the video, the back of the bus. So I said, the back of the bus doesn't show me anything. Show me the front. She refuses to show it to me because she says it doesn't show anything. I said, thank you for your opinion. Let me see the video. She finally sends me the video, and guess what happens? The video shows everything. My client was not weaving in and out of the road, but they wanted to see what the attorney was going to do with that information. And you know what else she did? She sent me a release for $25,000 without a single medical record saying, here's $25,000. We have a video that shows your client's at fault. Take the $25,000. Why the f*** is she giving me $25,000 if she has a video that shows that they're not at fault? So what did I do? You know, like Neo in the Matrix? We're not taking the $25,000. We filed a lawsuit, we worked up the case, and now it's settling for like $125,000. All because I didn't buy the that the adjuster gave to me.
Sounds like having an attorney is really
Here's some legal
important
hacks
in
that
any
insurance
case.
companies don't want you to know about your accident case. Number one, you don't have to accept the first offer that's thrown. You get one.
That's crazy.
Have you ever wondered why insurance companies rush to call you right after an accident? It's not to help you. It's to protect their money. Here's how it works. The adjuster sounds friendly, but they're trained negotiators. They'll ask questions like, how are you feeling today? And if you casually say, I'm fine, they'll document that and later use it to argue that your injuries aren't serious. They'll even try to record your statement and twist your words. Every single thing you say can lower your claim value. At Accident Experts, we know these tactics inside out. We connect you with doctors who properly document your injuries and attorneys who make sure that the insurance companies can't take advantage of you. It's about protecting your health, your rights, and the settlement you actually deserve, not the lowball that they want you to take. If you've been involved in an accident, contact us today at 1-833-365-FREE for a free consultation.
What's something insurance companies don't want you to know?
You are entitled to purchase first-party insurance coverage. It can oftentimes be dollars or $10 per month, less than hundreds of dollars per year. When you need it or your family needs it, it can pay out hundreds of thousands or millions of dollars in place of another vehicle that either didn't have enough coverage or didn't have coverage at all. It's very cheap insurance coverage. They don't want you to have it. You and your family absolutely need it.
I don't have insurance right now.
Me and Gen Z loses our parents' health insurance at 26, so here's the U.S. healthcare scam explained in 2 minutes. In the U.S., we use a health insurance-based model, and insurance companies farm you in 3 different ways. First, there's your monthly premium. It's like a streaming subscription for your health. 2, you've got a copay out of pocket every time you use the plan, kind of like renting a movie on a streaming platform you already pay for. And a deductible. It's the amount you have to pay before the company will even pitch in and help. Those rates are based on how expensive they've calculated your healthcare is going to be over your lifetime. The older and sicker you are, the more they charge you. Before Obamacare came around in 2010, they could just completely refuse to take you as a customer if you had pre-existing conditions like cancer, because the point here for a company is to make money, not to keep you healthy. We pay more for healthcare here than any other developed country in the world by far. Medical debt is the #1 cause of bankruptcy in the US, and it's not even a word in Europe or Canada. That's because greedy, unnecessary, for-profit middlemen make billions in our system while contributing absolutely nothing to it. Health insurance companies are parasitic. They literally add nothing. Their entire business model revolves around charging you more money than it costs to cover your care. So every dollar of profit that they make is just stolen from patients. They also reject as many patient claims as possible. And this is the immoral practice that bothered a certain Luigi enough to act out. But it's not just insurance. There are other middlemen scamming us. Pharmaceutical companies develop drugs using taxpayer-funded research and then sell us back those drugs at a jacked up rate. PBMs, pharmacy benefit managers, are almost no one can tell you what they do. It really seems like their whole job is just to make everything more complicated and expensive. In the wealthiest nation in human history, the ambulance should not cost as much as a semester of college, and you shouldn't have to wait on hold for an hour to see a doctor. Medicare and Medicaid are two wildly popular federal programs that ensure healthcare for the sick, disabled, impoverished, and elderly populations. We could simply expand Medicare to include everyone, cut out the middlemen, and save countless lives and trillions of dollars. But lobbyists have bought off both sides of the aisle, making sure our politicians do nothing to fix this. I'm calling out corruption on both sides and making our system just a bit more understandable. Follow to keep up.
Let me read you an insurance denial letter that I just got. Backstory, this patient has atopic dermatitis, which is eczema, which I documented, and I submitted for a prescription for a cream called Opzelura, which is safe to use around the eyes. I did not want her to use a topical steroid or something like tacrolimus near the eyes because I'm afraid it would get in her eyes and cause problems, which I would consider a medical reason to not use that. Insurance said back, use of the requested drug is only approved for the treatment of certain medical conditions. Your doctor has not indicated that you have a diagnosis of either mild to moderate atopic dermatitis that affects less than 20% of your body. Let me go to her note, my note. All right, in my note, diagnosis, atopic dermatitis, total body surface area, 10%. Do you and I agree that that's less than 20%? Back to the letter, the second reason they denied it. Your doctor has not indicated that you have tried both required drugs, which is a topical steroid, or a topical calcineurin inhibitor such as tacrolimus. And it says your doctor has not indicated that you have tried both required drugs or that you have a medical reason to avoid all topical steroids and calcineurin inhibitors. Let's go back to my note. She cannot use steroids or tacrolimus near the eye, so we'll submit prior authorization for Opzelura. Third, this is what the letter says. In addition, use of Opzelura requires ongoing use of topical emollients, a moisturizer. Based on the information submitted, your doctor has not indicated that you will continue using topical emollients and good skincare practices as a component of maintenance treatment to help prevent flares of your condition. Let's go back to my note. Under the plan, atopic dermatitis. Skincare. Patient should bathe using lukewarm water and a mild cleanser and moisturize immediately after. Emollients should be applied at least 2 to 3 times daily. The denial letter says that I did not document that. So clearly, insurance companies are not reading my notes.
Yeah, I had another one that this lady was the actual doctor. I forgot to put it in here. I thought it was in here. I guess I didn't put it in here, but it definitely makes me view insurance differently. I'm going to continue my research, continue going down this rabbit hole because it's very interesting and I want to help the people. I want to help people see that we literally, when I say that we are getting effed raw with no lube all the way around from behind, I mean that. Everywhere. Everything. It's a lot. Well, I hope you enjoyed today's video. Thank you for tuning in to Lady Boss Energy, where we uplift, motivate, and inspire each other to get shit together. If you haven't already, please like, comment, and subscribe. And if you know somebody who you think would enjoy watching this, share with them. I hope you have an amazing 24 and the best 7 yet. And I pray that divine radiates love and kindness and compassion and abundance and peace and joy and all the things over your life today, tomorrow, and forever. So I see you on the next one. I love you.